Hi, this is Dr. Monroe, and I'm back with your weekly chiropractic health and wellness update. This week we're going to do something a little bit different. I'm going to attempt to summarize our entire breast cancer prevention class in about 7 to 10 minutes. We're going to primarily hit the high notes on this with some information that you can take advantage of and start to use right away. There might be some information you might have to take another look at and look up a little in greater detail from a reliable source. There's also going to be some information where you're going to look at this and say, I need a little help with this. And, you can bring that back to the office and we can help you, work to help improve your overall health and wellness, as well as, decrease your risk of developing, breast cancer. Let's really get started here. What is prevention? Well, prevention is actually an act. It's you doing everything you can, spiritually, physically, emotionally, nutritionally, physiologically, to allow your body to function at its maximum capabilities so that it has a strong immune system and it's able to fight off disease the way it was designed to do. Now, unfortunately, a lot of people confuse awareness and detection with prevention. And even though awareness is important, and as is detection, and a lot of people do use a mammogram, but it's not an act. It's a form of detection. Matter of fact, it's a form of early detection. So where it has its benefits, it actually helps with early detection, but you already have the disease. Our goal is to give you information so that if you go and have a mammogram, the chance of something showing up is less and less. That's what we ultimately want. So, and here's another interesting thing. Do you know that only about 50% of all women who should be getting mammograms are actually getting them on a routine basis? And actually only 30% of women admit to doing a routine self-breast exams. So, those are relatively low numbers, and it's not being used the way they should. Now, I'm not totally sure about this, but some of it may be that, some of the inconvenience as it relates to a mammogram. Some people are just uncomfortable getting them. Well, I'd like to throw a method out there that you might be interested in, and that's digital thermography. This is a fascinating test. It measures the temperature of your skin, and it can help pick up inflammation or increased blood flow 8 to 10 years sooner than a regular mammogram. And that's tremendously important because it's well known that cancerous tissue is highly vascular. It's cheap. The price is relatively cheap. There's no touching the body. There's no radiation exposure, and you're done in about 15 minutes. This is a fascinating test, and there's actually 2 facilities we recommend in Columbus. And if you'd like some information as it relates to that, just call the office. We'll be glad to give you some information. There's another test that a lot of people aren't familiar with, and that's called the Estronex test. And this test actually measures the ratio of 2 estrogen metabolites in your urine. Now, if research has shown that if that ratio is off, you actually have a 300% chance, 300% increased risk of developing breast cancer. It's really an interesting test because it actually helps measure some liver function, as well as it gives us an idea as to whether you may have too much estrogen in your body. And as we know, estrogen is present in high amounts and a driver for a lot of cancers, especially breast cancer. But what's fascinating about the test is, if we see that your ratio is off, we can institute some lifestyle changes, maybe change some nutritional support for your body to help allow your body to function better. And 6 months, 8 months later, you can do this test again, and you can actually start to see how your ratio is actually improving and actually decreasing your risk of developing breast cancer. This is a great test, and we do it here in the office. So 2 great tests that I think you should be aware of that I'm not sure many of you are aware of that actually exist. There's 3 major pillars that we actually talked about in our class, and that is the role of nutrition, the role of hormonal imbalance, and the role of inflammation. Now nutrition is a key component. Colin Campbell, he's a nutritionist and a biochemist, and he basically states that nutrition is the tail that wags the dog of cancer. And basically what he's saying is, if you have poor nutrition, you're going to increase the risk of developing breast cancer or any other type of cancer because you're not giving the body the nutrients that it needs to have a functioning, healthy immune system. It's not able to fight like it should. And unfortunately, we live in a society that we're overfed and undernourished. We tend to eat a lot, but there aren't any nutrients, so our body functions at a deficit. And it's one major role. Is it in a role in a battle against cancer or any other breast cancer? Now, Dr. Campbell's actually in two movies that I strongly recommend you watch, and you can find them on Netflix. One is called Food Matters, and one is called Knives Over Forks. Two great movies that will give you volumes of information as to the role of nutrition and your overall health and your risk of developing cancer or breast cancer. So, very important thing to look at. Another thing to look at is the role of iodine. The second highest concentration of iodine receptors in the body is actually in breast tissue. If there's a lot of iodine receptors in breast tissue, that tells me that iodine must be important for the breast. So, and there's a doctor out there, Dr. Brownstein, who's done tremendous amounts of research as it relates to iodine, fibrocystic breast disease, breast cancer. Even iodine has a role in all of those. It even has a role with estrogen metabolism. There's a lot of information available on that, and I can't cover that all right now. So I'd strongly recommend you go look that up on the internet. Look for the information from Dr. Brownstein. He's an expert in this area, and you'll find where iodine plays a major role in breast cancer prevention. And just by trying to get some of that in your diet. Just on a side note on that, that the Japanese women tend to consume 25 times more iodine than American women. And breast cancer in Japan is the lowest rate in the world. That tells me something there too. So iodine must have a role, and I think you should go take a look at that. Now, something else we look at is the role of hormones or estrogen dominance. Estrogen is a driver for many tumors. It's a stimulatory hormone. It's a pro-growth hormone. And unfortunately, a lot of women tend to have a lot of estrogen dominance. Now, you can have estrogen dominance from maybe your body's not producing enough progesterone. You may not have you may be exposed to a lot of trans fats. You may be exposed to a lot of estrogen that could be in your skincare products. And that's where it sneaks into you a lot. You think you're doing something good for your body, but ultimately you could be giving yourself some long-term harm because it tends to accumulate in your body. Now there's a couple ways to test for estrogen, and we actually prefer a saliva test. But a real good way to find out if you may or may not have estrogen dominance or too much estrogen is just go search estrogen dominance and on the internet and look at the symptoms. If you have a tremendous amount of a lot of these symptoms, there's a real good chance that you're estrogen dominant or maybe have too much estrogen in your body. That'd be a real good indicator that you can go ahead and start and get a saliva test, do something we do here in the office. Or, we can start working on some lifestyle changes to help your body start to decrease your exposure to estrogen, decrease your exposure to toxins and xenohormones, and things that allow your body to function, allow your liver to function a little bit better so that you can metabolize estrogen. There's a lot we can do there. So go ahead and search that and look at those symptoms. If you're someone who has a lot of those symptoms, take the time to make an appointment. We'll be glad to sit down and talk to you about that. The other big pillar is inflammation. There's good inflammation and there's bad inflammation. Good inflammation is something you'll see with a sprained ankle. But bad inflammation is systemic inflammation, something that's going over your entire body. Inflammation, that's something Dr. Oz talks about, first of all, it's a cause to many chronic diseases. We see it in a lot of our fibromyalgia patients. But inflammation is kind of like glass running through over all of your tissues. It can cause damage to blood vessels, to tissues, to cells. It actually can alter your DNA. So, there's a huge issue with inflammation. So we need to find the source of inflammation and actually try and reduce it. Now, many causes of inflammation can be chronic viral infections, parasitic infections, chronic bacterial infections, but also something is from what we eat. We tend to eat diets that are rich in carbohydrates, but that causes our body to produce too much insulin. Insulin is an inflammatory hormone. It leads to insulin resistance and, of course, type 2 diabetes. But stress causes the body to release cortisol. Cortisol is another inflammatory hormone. So there's some things that right there that we can look at to decrease some inflammation in our body. There's also, of course, there's food sensitivities. If you're allergic to food or sensitive to certain types of food, you can be setting yourself up for chronic inflammation there too. Now, there's a way to measure for inflammation, and that is a C-reactive protein test. Now, that is a test that I believe everybody should be getting every time they have their blood drawn. And if you're not getting that test done, you should demand it being done. And if you're not getting it, obviously come to the office. We'll be glad to do that test for you. It is a great marker and lets us know how much inflammation is going on in your body. Then we can start to take steps to help you reduce the amount of inflammation that's going on. Now, I'm going to hit one more point here, and that's actually the role of genetics. Now, research says that genetics shows up anywhere between 3 and maybe 8% of the time as it relates to breast cancer. That means those BRCA1 and BRCA2 markers are actually positive and present. Now, that's a very important test, and especially if you have a family history, I think you should have that test done. But the reality is, if you're looking at 3 to 8%, that tells us that 80%, maybe even as high as 90% of cause of cancer or breast cancer is actually your lifestyle. Things that you can take an active step in, something that you can do to have an overall effect on your overall health and wellness. Now, I hit 3 big topics right there, and there's a lot of areas to go. But again, the main action for breast cancer prevention is something that you can do. It's not just getting a routine mammogram, and it's not just being aware that you could develop breast cancer. So, real quick review. Get a thermogram. Consider getting an Etronex test. And then start looking at these 3 major pillars that we talked about. And that is the role of nutrition. Make sure you have complete nutrition. Keep your inflammation down. And what's it going to take to make sure that your hormones are balanced and keep you that way? This is great information and something that you can start to chew on right away and start to improve your overall health and wellness. Thank you for spending some time with me. If you have any questions, please feel free to call. We're here to help you.